Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome to all of you joining us here today. I'm back here again talking about our Gold Neonatal Conference. Oh my goodness, we have some amazing presenters this year, I have to say. And of course, I'm delighted. I'll be introducing another one to you in just a moment. But to get all the details on this, and time is running out, I want you to go to the website right now, goldneonatal.com. You can pause on there and take a look at all that's coming up here. It begins on May 31st, so right around the corner. You'll have an opportunity, of course, to join us for our opening keynote, which is free of access to everyone. All you have to do is register. Now, you will be able to register for this entire conference and event, as I mentioned, at goldneonatal.com, including the presentation that we're going to be talking about in just a moment. But of course, let's introduce you to one of our presenters here. I'm very excited to introduce Sandy Jose, who is here with us today. Sandy, welcome. It's great to have you here at Gold Neonatal.
Thank you, Fiona. It's really exciting.
Yeah, absolutely. And we're so happy that you're here with us. I know you've been working very hard on this presentation, and I know that you are excited to present on the topic. But first of all, why don't you actually tell folks where you are in the world? Remember, this is our international audience coming to you here that are going to be coming to you live on the day. So let them know where you are and where you work and sort of some of the things that you do.
Okay, well, thank you. So my name is Sandy, and I'm originally from Houston, Texas, and that's in the United States of America. And I've been working at Texas Children's Hospital, which is one of the nation's best children's neonatal intensive care units, for almost the last 10 years. And so my passion is always those premature babies, because they're so fragile, and they're just a pleasure to take care of because they can't speak for themselves, so I'm their voice.
Oh, that's wonderful. Well, thank you for sharing that, Sandy. Now tell me, how did you, was this a journey that you knew you were going to take? Did you always know that you were going to end up in a neonatal unit? How did this all come about?
Well, actually, that's interesting because when I went to nursing school, like even when I joined the program, I knew that I wanted to do something with newborns. And so the question was, do I want to go to the intensive care unit or just newborn nursery kind of a route? But during my clinical rotations, just spending some time in the intensive care unit, I just knew that that's where my heart belonged. And that's how my passion was there. And I started my career there. And I've been a nurse in the intensive care unit for almost 15 years now.
Wow,
And
that's
of
amazing.
which I've been a practitioner for 10 years.
That's amazing. Well, I have to say this, I've been interviewing people, as you can imagine, for this event coming up. Got many nurses like yourself who I ask similar questions to. I ask them about, how did you begin? What's it like for you? But each one of you, interestingly, of late have said, have been there for a long time, that once you go into the neonatal unit, it really does, take sort of a grip of you. You want to stay. And we have lots of people who've been there for many, many years. Sandy, I can only imagine that the work that you do, maybe to the outside world or to those that are just coming into the field or those who are just starting out their career as nurses, it might seem quite intimidating and it might seem like it's a very intensive job. Are all those things true? Like, talk me through some of those things, how you sort of stay on top of that and even manage that for yourself.
Yes, so it can be intimidating depending on what perspective you see it from. For me, I feel like starting off with a small miracle where you're not just taking care of the patient, you're taking care of their parents as well. And it's just like a comprehensive family-centered care. And, even though it could be intimidating based on their size, they could be small, but their problems could be really big. And so it's a lot of fun, and it keeps me very like on top of things to make sure that I see like the slightest changes in their vital signs and how they present from day to day, because neonates are really fascinating. Today they may have one problem, but tomorrow another problem might be something that could be life-threatening. And it's just to be on top of that is just, it gives me motivation to keep being on top of things and making sure I'm able to take care of them.
That's wonderful. Well, it's great to hear. And I
Yes.
can imagine that you do. I mean, I only can imagine there's a lot of collaborative care and that goes on in the neonatal unit as well. So you're working with lots of different didactics in there. So you're actually doing a lot of crossover care as well. So you probably get to meet some very interesting folks that specialize in very unique areas.
Yes, we definitely do. Because, it's not just one specialty. Like the babies have like cardiovascular issues, they have respiratory issues, nutritional issues. So it's like multi collaboration all the time. And so I feel like we're always providing comprehensive care through an interdisciplinary group. And it's just fascinating.
Yeah. And I love the fact that you talked about family-centered care. I must touch on that because that's really more of a focus that where I would come in as a practitioner working with families as a lactation consultant. So I generally are meeting with the families even before I meet with the infant per se, and then the staff on site. So I love it that nowadays there's in most NICUs today, you're going to see a lot of family-centered care, which has really taken off. And I know many places around the world are still trying to improve that, but tell me, what's it like in Texas right now in your unit? Is it all shared care? Are you incorporating families? What happens with a family on the ward these days, Sandy?
So for us in Texas Children's Hospital, we do see like outcomes for neonates are really truly impacted by their families, like their involvement, and the parents are the biggest advocates for their babies, and they know what's best, and they sometimes can sense when something changes, and
Mm,
it's their internal intuition that honestly sometimes can save their baby's life. And we definitely promote family-centered care. We encourage parents to be there at all times when they can. It's 24 hours. And part of like, you'll see it during my presentation, we really encourage kangaroo care and
mhm.
skin to skin contact with the newborns because it makes a tremendous effect on our babies and their neurodevelopmental outcomes.
Oh, beautiful. Oh, you're speaking my language. That's awesome. That's great. All right. Well, speaking of your presentation, let's get into this a little bit. Now, I'm just going to let folks know what the topic is, and then I'm going to ask you a couple of questions about it. So it's titled The Neuroprotective Approach to Reduce the Risk of Intraventricular Hemorrhage in Extremely Low Birth Weight Neonates. So this sounds like a pretty big topic to me. So first of all, maybe you can tell me why this topic is important to you, Sandy.
Yes. So this topic is important to me. And when I was doing my DNP project, when I finished my doctorate of nursing practice, I wanted to find a project that went beyond just the inpatient setting. And I kind of wanted to see like how my patients were growing and developing in the outpatient setting. And it was really, really fascinating because, a lot of times inpatient will see that, oh yeah, your baby has intraventricular hemorrhage. And so we will be following it as outpatient. And so I wanted to see what that outpatient follow up kind of looked like. And it was really heart touching to see that, sometimes we don't realize it because intraventricular hemorrhage occurs within the brain and you don't see that effect until they start to grow and develop.
Mm,
And so during my clinicals as a doctorate of nursing practice, I was able to go to these long-term outpatient clinics and I saw the impact of IVH, which is intraventricular hemorrhage, and how it can cause a long-term impact on the patient and their families. So that's kind of where I wanted to implement something where we try to focus on providing neurodevelopmental and neuroprotection care from the
mm,
beginning,
right.
because it's small measures that we do now as they grow in the immediate period that can affect their lifelong outcomes. So
Mm, wow. I mean, these are really important measures. Now, so essentially, you're going to be talking about how to reduce these risks, looking at the research, obviously at the outcomes, as you said.
mhm.
But tell me, have things changed even in, the time that you have been in the NICU, and how you put practice into place, and have policies changed on how to protect these little ones based on intraventricular hemorrhage?
Yes, absolutely. So intraventricular hemorrhage, unfortunately, it's inevitable. Like when you're born premature, you're at
Hmm.
high risk. Just being early prematurity, like less than 32 weeks, and very low birth weight, being less than 1,500 grams, you are at risk for developing
Mm,
this. And so it's just little measures that you see from bundles that were captured from various quality improvement projects that you'll see that how can you prevent the risk factors that can cause IVH in neonates. And
right.
so it's not one recipe to fix everything, but it's little measures combined into a small package that can help to reduce the risk for IVH.
Excellent. So this is going to be a really, really important topic. I can tell right away, like you
Yes.
need to have this information in order to put best practice in place. And like you said, really improve the long-term outcomes of these neonates, which is so valuable. Thank you so much. That's
Yes.
amazing.
You're welcome. It's my pleasure. And I'm very excited to be able to speak on this topic and hopefully enlighten others and teach them something about IVH and how to reduce the risk.
Absolutely, this will be fantastic. So you heard it here. Sandy's going to be talking about for this event. So make sure that you attend this live presentation. You'll have an opportunity, of course, to ask questions and engage throughout the presentation. Well, thank you so much, Sandy, for joining me here today. It's been fabulous having you.
Thank you, Fiona. It's my pleasure.
And of course, thank you to all of our viewers once again for joining us here as we sat down and talked about this presentation. You can go ahead to the website right now, goldneonatal.com. You can check out when everybody is going to be live. So look at the schedule. It will be, of course, all in your own personal time zone, so you can get all the dates and times correct and on your calendar. We will look forward to seeing Sandy there live. And of course, we'll look forward to seeing many of you there live as well. Now, if you can't make all the live sessions, that's okay. Every session is going to be recorded, so you'll have opportunity to go back and listen to all the presentations at your convenience. Well, thank you so much for Sandy Jose for being with us here again today. And of course, to all of our viewers, we hope that you have a wonderful rest of your day. Bye-bye for now, everyone.
Bye.